Hello everybody. Today we have Dr. Akhil Dadi garu, who is one of the famous specialists in orthopedic surgeries of Srikara group of hospitals with us. Let us have a brief discussion about orthopedic surgeries. Hello sir.
Hello.
Welcome.
Thank you.
And sir, can you please share your achievements with us, brief achievements?
Yeah, I am Dr. Akhil Dadi. I am the chairman and chief joint replacement surgeon of Srikara group of hospitals at the twin cities of Secunderabad and Hyderabad in state of Telangana, India. And I started doing my joint replacements in 2001. So now it's close to 15 years since we started doing joint replacements. We always strived to give the best to the patient because that is the same way, the same plate they had reciprocated back. Getting the best in technology was always the first thing and prerogative, giving the best in technology to the patients, and that made us introduce in 2006 computer navigation. We have been doing most of our knee replacements with navigation at that time, and today we are doing it for those who need it. In fact, as the latest step in 2015, now we have introduced navigation in hip replacement also. I was the first to do the gender knee replacement in this part of the country. One of the first to do the oxenium very last, and so getting the best technology was a prerogative. We are one of the highest number of very last oxenium, which is supposed to last about 30 years, at least in lab conditions. We are one of the highest centers in South India doing very last oxenium. Also, one of the largest centers doing Johnson & Johnson's premium product called CR150. Okay. So having said all this, because of the immense support and confidence shown on us, showered on us by our patients, we are today doing about 1500 knee replacements every year, placing us in one of the top centers in India as well as on the world map also. So this on the brief is achievements, and the team has we are a group of now about 16 orthopedic surgeons in spread in 2 hospitals. We are catering to the best in trauma surgery, the best in arthroscopy and ACL reconstruction, giving highest quality in hip replacements, ceramic on ceramic kind of highest thing in hip replacements, and the best in spine surgery also.
Okay. Sir, Srikara is doing 1500 replacements per year, and you are one of the topmost doctors, and with the same replacements while you are doing, you will face few difficulties also, or some precautions you will be taking. So can you please share with us?
Yeah, the basic precaution is the difficulty or the precaution is in doing a safe surgery. Okay. And most of the patients who come to us are of elderly. They are suffering from hypertension, that is BP or sugar, or previous heart problems or thyroid. They don't know that they have heart problems. So the precaution is that we evaluate them perfectly before surgery. Okay. According to us, the surgery is not a very great part or a difficult part. The difficulty is not to miss the patient who is having a underlying heart problem, a thyroid problem, a urine tract infection, undetected diabetes, so that during surgery and after surgery they don't have any complications by and large after surgery. Otherwise, doing difficult cases, we would love to do difficult cases on table. They are more challenging cases, so that is not the difficulty.
And now let us go deeper into the knee replacements. Who actually needs this knee replacement?
Anywhere in the world, the 6 criteria are seen in selecting a patient or suggesting a patient a knee replacement. The first criteria is that the pain in the knee should have been there from at least 1 or 2 years. It's not that it is there for the past 3-4 months and a knee replacement has to be done. So they have been having pain at least for a couple of years. Their suffering has increased in the past few months. Point number 1. The same pain, number 2, is not allowing them to stand for 10 minutes. Women are not able to cook, stand and cook for 10 minutes, they have to sit. Men are not able to stand and do their work for 10-15 minutes, they have to sit after 10-15 minutes. So not allowing you to stand for 10 minutes. The third point is the same pain is not allowing you to walk beyond half a kilometer. You are having difficulty as such in walking half a kilometer because of the pain. You are struggling to walk, you are waddling, you are pulling your leg for walking. This all you are not able to walk. After half kilometer you will have to stop. Yes. Somebody who is walking 1 kilometer, this surgery is not required. who is able to walk 1 kilometer, not much of pain, is able to go for walks every day, morning or night, whenever. For them, the surgery is not suggested. Fourth thing is, climbing stairs becomes very difficult, and if it is a big step, you have to climb and put inside your leg into the car, or a big step you have to cross, it becomes very difficult. Fifth point is that whatever medicines you have used, or exercises you have done, physiotherapy you have done, whatever you are using, medicines, Ayurveda, homeopathy, Unani, whatever system, allopathy, nothing is working on you. The pain is remaining as it is. Sixth thing is, you have gone to a doctor, you have gone to a center, you have gone with all these complaints, and their your X-ray is taken, your radiograph is taken. You should have severe degeneration, wearing out of the knee. We call it stage 4 osteoarthritis. Stage 4 of arthritis, the last stage of arthritis. So all these 6 points, if you have only, we suggest a knee replacement.
What is done in knee replacements?
This is the knee joint, the healthy knee joint, which is protected by the cartilage, by the washer or the meniscus, and the cartilage down. Now in arthritis or in severe arthritis, the cartilage is completely lost. The meniscus washer is completely lost, and the cartilage is completely lost down. So in knee replacement, just like your car tire which is worn out is replaced, this worn out cartilage completely is replaced by the metal. In this shape, it is made to the exact shape like this. Similarly, the cartilage down which is worn out is replaced by a metal down, which you see here, and in between both these cartilage, the meniscus or the washer which is worn out is replaced by a plastic insert. So this is the basic of knee replacement anywhere. Either worn out cartilage is replaced by a metal, worn out cartilage replaced by a metal, and the worn out meniscus or washer is replaced by a plastic insert. Now a lot of people think that it is a knee cap replacement, but the knee cap, nothing is done, it's just pushed to the side, and the original knee cap of the patient is kept as it is. We generally don't change the knee cap. The entire knee joint inside is changed. Now instead of the metal here, there is an oxynium, as I told you. So this oxynium is black like this in color. The surface is oxidized, no release of metal ions, so no allergy to it, and the plastic which is used with this, called Verilast, is tested in the lab to last against wearing away of the joint for 30 years. The FDA approval is for in vitro studies done in the lab, so that this combination of oxynium and Verilast may last for 30 years against wear.
What are the new trends and implants that taken place in knee replacements?
The basic development in knee replacement has been concentrating on so that it lasts longer. It lasts very longer, and for that nowadays they are using more of XLP into this, that is highly cross-linked. The insert has been made so that it lasts longer. Also there are implants like which fold more. You have to get good flexion so that you occasionally want to sit down, or you have to sit on a chair, but everybody would like their knee to fold more. People would like to read namaz sitting down like that. In India, they would like to sit down and do some puja. So the concentration is so that the knee folds more, and you use high flex designs. So that is the main thing, and then the plastic should last longer. Apart from this, another development has been in the change of the metal in using oxynium. Now oxynium also is a metal, but its surface has been oxidized. So if you look at this metal will release metal ions, and some people might get allergy on the skin in which it is attached to. But on the oxynium, because there is no metal ion release, there is no allergy to oxynium. Apart from this, there is a study and an FDA approval for the plastic insert which is used with oxynium. It is called Verilast. So the FDA approval is for a lab tested and in vitro studies that the insert lasts for more than 30 years against wear, W-E-A-R, wearing, that is getting worn out. So these are the latest things as far as knee replacement is concerned. So we tell patients to clearly decide whether you want to undergo a high flex stainless steel cobalt chrome with a highly cross linked poly, or you want to undergo a knee replacement with an oxynium with a highly cross-linked poly.
So before the surgery itself, you will just
Yeah,
explain them what is what.
Yeah.
Okay.
Yeah, they will decide, and we tell them that this 30-year lasting or this 20-year lasting, they are all lab tested things.
So it depends on the patients which they select.
Yeah.
Sir, does it come under fast track surgeries?
Yeah, see, the basic term of fast track surgery is that the anesthesia which is given nowadays is so that patients don't have pain after surgery, and we make them walk anywhere between 3 to 6 hours on the same day of the surgery.
Okay.
So this is the term from where this fast track surgery is arrived. It is actually a fast track. It puts you fast on the track because of the anesthesia given, and because the surgery is done by experienced people very fast. Like somebody like me takes about 15-20 minutes to do a knee replacement, another 20 minutes or so, 40 minutes the surgery is over. With this, the damage which you do is very less to the surrounding tissues of the knee. So this anesthesia techniques as well as your surgical technique, doing a minimally invasive surgery, doing it fast without touching too many tissues, makes the people walk on the same day of surgery. This is the fast track surgery, and they go home also early. One knee they go home in 2-3 days, two knees they go home in 4 or 5 days.
So they need not take rest for longer time.
No, today there is no rest.
Okay.
In fact, most of the women, they start working at home in 15-20 days.
It's very good technique actually.
Yeah, it is very helpful, and it boosts the confidence of patients. And men come driving sometimes, even we are surprised in 20-21 days when they have to come back and show us again after 3 weeks. Generally local people, when they are staying, they come back and show us in 3 weeks. There are some men are driving their own vehicle and coming. So this is what surprises us. So recovering very fast from surgery and coming back to normal life, this is the fast track surgery.
Can you please share the success rate and what are the complications you face?
Yeah, the success rate of this surgery is almost 100%. Now you have to do the surgery properly and it will succeed. You have to select your patient correctly. The patient should have all the 6 criteria, if whether they require a knee replacement. The evaluation before surgery should be thorough so that they should not get a complication post-op as far as possible, and it should be done in a fast track. So if you do all this and you take proper care in your theatre, like we are doing our care, all the theatres are with laminar airflow, so the air is filtered, and also that the infection rate is very low, is 1 in 400, 1 in 450 the infection rate. If you do all this properly, it has to be a successful surgery.
And sir, please inform us the facilities that you provide in Srikara hospital.
Srikara Secunderabad, as we said, a 100-bedded facility which has been doing now more than 1200 to 1300 knee replacements a year, has 4 operation theatres exclusively for joint replacement. These 4 operating rooms, all of them are so-called eye suits, where the information which is happening, whatever knee we are putting inside or the surgery which is going on, is shown, a part of it is shown live to the attendants who are standing outside, so that it boosts up their confidence that doctor has put the implant which he has promised. Number 1. Second thing is, all the theatres are having laminar airflow, so that the air conditioning is filtered, micro filtered. There are no bacteria coming from the air conditioning, and utmost care is taken in putting all imported implants only. All implants which are CE and FDA approved, which are manufactured either in Germany or USA, so wherever they have a CE and FDA approved, only those implants are used. By doing this, the infection rates have come down. Apart from this, we have a 25-bedded ICU in Secunderabad, and we have multiple suite rooms, deluxe rooms, and we have a cath lab facility, also a cardiac facility for evaluation of the cardiac problems. So the entire with a CT scan. Our Miapur facility has is a 200-bedded. Again, we have a supportive cardiac unit. We have 50 ICU beds. It has 200 beds, and we have suite rooms and deluxe rooms made exclusively for joint replacement. Yes, we have 5 theatres in Miapur.
Sir, what are the other surgeries that are performed in Srikara hospitals? In
our orthopedics only, we are concentrating on trauma also. Another wing looks after trauma in both the hospitals, where the best of imported implants which are made in Switzerland, the AO or Synthes AO or our Smith & Nephew. So implants of such high grade quality are used in our trauma. We also do a lot of ACL reconstruction surgery as well as arthroscopic surgery, where we do the ACL reconstruction in a double tightrope technique. So highest technique with the best of implants is done even in arthroscopy. Apart from this, we are doing high level scoliosis surgeries, that is very bent backs. The scoliosis surgeries are done by our scoliosis surgeon Dr. Ambadas Katare. Each unit is headed by unit chief, and they are looking after their respective departments. The cardiology and the critical care and general medicine departments give us the supportive care for our patients.
Okay, sir, not only the local patients, but we are also having international patients. What are the facilities you are going to provide for international?
Yeah, we are grateful to the patients who confide, have confidence in us and are coming from so far, are probably changing 2 flights, 3 flights and coming, getting their visa process done and all. It's such a big hassle. We respect that, and we would like to give you the best here. Your stay will be longer, so we start from a pickup at the airport. One of our guys who can speak Arabic also, because that is the language, will pick you up at the airport. You will be placed in the best of suite rooms or deluxe rooms, and your attendants along with you would be given food of your choice. In between, you would stay a little longer, about 10 days you would stay, so that you just don't go back home on second or third day. You will have that kind of pain again. Such a long travel, it would not help you. You would stay longer, 10 to 15 days. Once you are a little better, you can also go out and see our city and enjoy our Hyderabadi cuisine, as well as see whatever good you would like to see in Hyderabad. You will be dragged back to the airport, and whatever other facilities are required as far as your visa processing letters are concerned, we would be helping, our help desk would be helping you out with that. We are also planning that we have one small medical center where we come monthly once in Middle East and see you post operatively, which is required only once or twice after your surgery. So we ourselves come to that particular center in the Middle East, see you there, and we cater you there itself. That would save you a lot of energy, time and hassles concerned with coming back again and showing us. For any small problem, you can telephone us from there, or you can email us, and nowadays it's the time of WhatsApp and email. You can put on your pics on that if you have any problem, and we will immediately answer to that.
Sir, what are the latest things done in hip replacement?
Just like in knee replacements, the hip replacements now we are using more. Everybody in the world is using more of ceramic on ceramic. And previously they used to use more of metal on the plastic, but now more all over the world they are using ceramic on ceramic. This is because the metal on plastic gets worn out average on 15 years, but they are hoping that ceramic on ceramic lasts 30 years. Okay. Also ceramic on ceramic, a little who are not able to afford ceramic on ceramic, they will be able to we would be doing a ceramic on plastic on them, which also lasts almost the same period. Apart from this, if not ceramic, sometimes oxynium is used on again in the hip replacements also. The recovery in hip replacements is a little faster than knee replacements, so they also walk on the same day evening, but their pain is a little lesser than the hip than the knee replacement people, so they start doing their normal activity in 3-4 weeks itself.
Sir, what would you prefer, like oxynium or some metal?
See, oxynium first thing is costly, so we won't do it for everybody. Definitely, if somebody is able to afford, oxynium is a little better is what we are thinking, but it's only 2 years since we have been doing oxynium. Okay. Not having any allergy, and because of that none of our 600 patients who are operated till date with oxynium has any discharge from the wound. So we are thinking that our infection rates will even go down further with oxynium, making it almost zero infection rate. And if the plastic has been tested and given an FDA approval to last 30 years, so we are thinking that oxynium will be a lifelong solution, will last long, no infection, no allergies. But still, because of the cost, 75 to 80% of the people we would have to do a metal. For international patients, for example, if a knee of the metal costs 3 lakhs per each knee, the oxynium would cost about 4 lakhs. So this price difference would be there. Okay. I'd have to put. But otherwise the choice would be an oxynium.
Sir, whom would you give the credit of Srikara hospitals?
The credit is entirely to the patients from day one who have put their confidence into me. From the time I have decided to become a doctor and I have been studying, and patients who have put their confidence into me and today into Srikara, they are the base, they are the structure, everything for Srikara's success. The single group of people whom the success credit should go to is the patients. They have put in their confidence. They are rheumatoids, osteoarthritic patients suffering from so many years. They have been suffering, and they are putting themselves under the knife of a doctor is the most difficult thing, and they have done that, and that is the only reason why we are standing so strong here.
Whole credit goes to the patients itself.
Completely. We have a whole large database of patients, and recently on our first anniversary of Srikara, we are so grateful that 3,000 patients who have been operated by us came from different parts of the states and made that particular program a big success. We thought about 1,000, 1,200 would come, but 3,000 people coming itself shows the kind of love and affection and confidence they have on Srikara and me. We are extremely grateful to you.
It's a great thing that 3,000 came to your
first time something like that has
Yeah.
happened.
Thank you so much, sir. Thank you for coming and explaining about Srikara's group of hospitals and about knee replacements also. We are very thankful to us.
Thank you, everybody. And just like we have looked after our patients here in India, we would love to look after patient coming, having confidence in us from every nook and corner of the world and give them the best. Now our endeavor is to give the service to each and every person on earth who has confidence on us. Thank you.